Welcome back, everyone. Since the start of the pandemic, we've been periodically checking in with local health experts in the front lines of the fight against COVID-19. Joining us now once again is our pal, Dr. Rob Danoff, who is overseeing a testing site in Bucks County. Dr. Rob, thanks for being with us.
Thank you. Good morning, Jim.
So first off, the president announced yesterday that he's been taking the anti-malaria drug hydrochloroquine. Can you weigh in on this debate on this drug?
Yeah, hydroxychloroquine is a medication that we use to treat malaria or try to prevent it, or autoimmune diseases like rheumatoid arthritis or lupus. So in cases like that, we know that the benefits of using it outweigh the risks. But using hydroxychloroquine to prevent coronavirus 2019, there's no studies that show that it does that. And in fact, there are a lot of people who are taking that medicine for arthritis or lupus that have developed coronavirus 2019. So, I hope it works, but there's no studies that show it does. And in fact, the NIH has just opened up a study to enroll 2,000 people to take hydroxychloroquine, but those are only for people who are COVID positive and have symptoms. So, Jim, it was surprising.
It's not a preventative. Well, Pennsylvania Governor Tom Wolf and Philadelphia Mayor Jim Kenney yesterday are among the officials discouraging residents from going down the shore this weekend. So do you think it's safe to people make the trip? I mean, last week it looked like the boardwalks were kind of crowded.
Yeah, you're right. I had some friends who were down there and they actually left because it got too crowded. So here's the thing. We're opening up slowly. I think for mental health, it's good. But we have to remember that this is a very contagious disease. And while most people have minimal symptoms, certain people get extremely sick. So if you're out there, you still please wear the facial coverings or the mask and cover your mouth and nose. It's really, really important. And what I would say, and I said to some of my patients, those who have higher risk are senior citizens or those with diseases like COPD, heart disease. I'd rather you hold off. Try not to be around any crowds right now. Let's see how this plays out. Let's continue to test people. Let's continue to contact trace if anyone gets sick. And hopefully the cases won't keep on getting more because we're going in the right direction.
Well, speaking of the cases, right now, Bucks County is averaging 185 new cases a day. Philly's 251. We're in the red zone. Governor Wolf says that we have to be in like the high 50s on an average per day in order to get restrictions lifted. So, I mean, what are you seeing?
So in Bucks County, actually, our cases are starting to go down. There are less people in the hospital with this, although there's some really sick people in the intensive care units for sure. But I do think we're going in the right direction. Look, that average of 50 per 100,000, I don't know how realistic that is because in areas with dense population, it's harder to reach that number. Yeah. The other thing is, Jim, which is really important, they need to separate the data. They need to keep data for the nursing homes separate for the data from the general population. And I think that will give a much clearer picture and the numbers will go down in the general population.
Some positive news yesterday about a possible vaccine from Moderna. What are your thoughts on this?
Yeah, it's some really good news. And what it showed is that this vaccine did produce the same type of antibodies that have been seen in people who have recovered from COVID-19. So that's very promising. And what the company is going to do is in July, bring it to the next level, phase 3, which more people will be enrolled. And if it works out, then this could be released in early 2021. And there's a couple other vaccines in development that are showing some promise. So this is good news. So stay tuned.
So when we move into this yellow phase, many businesses are still remain closed, like hair salons. Look, I don't know if you can tell on TV, but this is like being held in place by lots of gel and spray. I mean, how long until I can get a haircut?
I was talking to a couple of my patients, our hairdressers are own places, and they're hoping the same thing. So this is what we're thinking. Hopefully in the next couple of weeks or certainly soon, they should open those places up. But practice, wearing masks, don't use hair dryers because that can aerosolize. And you know what? Instead of having the chairs so close to each other, alternate. You may not have as many hairdressers in at one time, but just alternate the hours. So we're hopeful that certainly Bucks County will start to go to yellow soon and then start to relax on the other. What they are doing is they're following states like Georgia and Texas and Florida that have opened up a little bit more, and they're monitoring the situation and to see how this goes, especially those like hairdressers and other type of establishments like that.
All right, a few more weeks, Dr. Rob, and I'm going to have a man bun, so I'm just warning you right now here on TV.
Hey, you're fortunate. You got some great hair, Jim.
Yeah, but it's getting really long. I'm going to start braiding it soon. Thank you, my friend. Please stay healthy and safe, and we'll be talking to you soon.